Well, the IN.PACT AV Access trial is the first global randomized study of a drug-coated balloon for hemodialysis AV access. We enrolled 330 patients throughout the United States, Japan, and Australia, New Zealand. And we hopefully feel that this will lead to a positive result and lead to global approval of the IN.PACT AV Access balloon for the treatment of dysfunctional hemodialysis access. We identified a patient cohort consisting of patients with autogenous arteriovenous accesses in the upper extremity. These were patients who had never before had a thrombosis of the AV access, never before had a stent placed in the AV access, and they had to have undergone at least 8 successful hemodialysis sessions before being approached to be enrolled in this study. Once the patients were enrolled, and the predicate for enrollment was having a greater than 50% significant stenosis in the AV access circuit associated with a dysfunctional hemodialysis access session with a lesion less than 10 centimeters in length, they could be randomized. The patients were randomized in a 1-to-1 scheme between, again, the IN.PACT AV Access balloon and plain old balloon angioplasty. So we've completed an enrollment, and the primary endpoint of the study is a 30-month safety and efficacy study, followed by a 6-month efficacy outcome analysis looking at freedom from target lesion revascularization at 180 days. That data will be presented in the fall of 2019. The data presented today was really the baseline data, which showed that obviously we were able to complete enrollment. The cohort was about 70 years of age. The majority of patients that were enrolled had forearm fistulas, just over 50%. We think that's slightly different than previous studies that have looked at hemodialysis AV access with respect to drug-coated balloon efficacy, where the predominant lesions were comprised of upper arm fistulas. So we think we're identifying and studying a slightly different population that could benefit from treatment with drug-coated balloons in AV access. Aside from that, the lesion lengths were again less than 10 centimeters in length. The dominant vein that was treated was the cephalic outflow vein from the forearm fistulas. And again, we're looking forward to the final outcome data in the fall of this year. Well, we hope that this will be a positive study, obviously, and we're looking forward to presenting the data in the fall of this year. We actually took a poll of the audience after the baseline data was presented, and 3/4 of the audience feel that drug-coated balloons should likely be considered to be first-line therapy for the treatment of a significant stenosis in a dysfunctional AV access circuit. We feel that the IN.PACT product will further enhance the benefits that we're offering patients in terms of improved primary patency, freedom from reintervention, and freedom from any revision, either endovascular or surgical, for their dialysis circuit. As we all know, these patients are constantly at the mercy of a failing AV access circuit, requiring repeat hospitalizations, repeat surgical procedures. These are all very, very costly. So anything that improves the patency, keeps patients from having successful dialysis is really a burden to the patient. And we think that drug-coated balloons are really the best way to keep patients healthy and having successful hemodialysis. Well, clearly the concern right now is for long-term safety. We plan on studying these patients for up to a 24-month follow-up to see if there's any safety concerns. Obviously, that's the theme here at the Linc Congress regarding the use of paclitaxel. But the primary endpoint, again, at 6-month follow-up, will be presented this fall. We will continue to present the data out to 12 months and eventually 24 months in the years to come. Our primary focus is on both the efficacy of the product at preventing target lesion revascularization, but also the safety of the overall product scheme to make sure that our patients are well cared for.